Hi everyone, welcome again to another nurse review. This is me, Nurse Rad. Let's start. Okay, which of the following is a potential adverse effect of oxytocin that nurses must monitor for? What's your answer? If you answer uterine hyperstimulation, then that is correct. Let's move into the next question. A patient in labor is receiving an opioid analgesic and starts experiencing nausea. The nurse anticipates the provider will experience which of the following medication? What's your answer? Methylgronovine, oxytocin, ondansetron, or carboprost? Okay, the answer for that is ondansetron. Let's move into the next question. A patient in labor is receiving an opioid analgesic and starts to experience nausea. The nurse anticipates the provider will prescribe which of the following medication? The answer for this is yes, that is ondansetron. A patient who is receiving oxytocin for labor induction asks why the medication is being titrated, increased or decreased throughout the process. What's the nurse's best response? A. We adjust the dose to control the speed of your labor. B. The oxytocin is titrated to ensure your contractions are strong enough to deliver your baby quickly. C. The goal is to have a contraction that are strong but not too close together to ensure the baby's safety. Or D. Titration helps us ensure that your pain level is manageable during labor. What's your answer? The longer the better. The goal is to have a contraction that are strong but not too close together to ensure the baby's safety. A nurse is administering oxytocin to a patient in labor. Which of the following maternal and fetal assessment should the nurse prioritize during the oxytocin infusion? A. Maternal blood pressure and fetal heart rate. B. Maternal heart rate and fetal head engagement. C. Maternal pain level and fetal movement. Or D. Maternal respiratory rate and fetal position. What is the most important here? Okay, what's your answer? Okay, the answer is maternal blood pressure and fetal heart rate. A nurse is monitoring a patient receiving misoprostol or Cytotec for cervical ripening. After administration, the nurse notes uterine tachycystole. Which intervention should the nurse perform first? First. A. Administer terbutaline as prescribed. B. Reassess the patient after 30 weeks. Take two. Reassess the patient after 30 minutes. C. Notify the healthcare provider. Or D. Prepare the patient for immediate cesarean section. Okay, so what's your answer? Administer terbutaline as prescribed. That will be your best answer. A nurse is caring for a 26-year-old patient who's being administered oxytocin to induce the labor. The nurse notes that the patient's contractions are occurring every 1 minute and lasting 90 seconds. Which of the following is your priority nursing action? A. Increase the rate of oxytocin. B. Discontinue the oxytocin infusion. C. Reposition the patient to her left side. Or D. Notify the healthcare provider immediately. What will be your answer? The answer for that is discontinue the oxytocin infusion. That will be your first priority. Which vital sign should be monitored closely before administering metoprolol? Again, which vital sign should be monitored closely before administering metoprolol? A. Respiratory rate. B. Heart rate. C. Oxygen saturation. Or D. Temperature. Okay, if your answer is heart rate, well, definitely correct. Which of the following is the correct timing for administering insulin lispro? Okay, 30 to 45 minutes before meal. B. Immediately after a meal. C. 15 minutes before or immediately after a meal. Or D. 1 hour after a meal. The answer is C. 15 minutes before administering immediately after a meal. Next question. The nurse is preparing to administer oxytocin to a patient post-delivery. What is the primary purpose of this medication? A. To relieve pain after childbirth. B. To help expel the placenta and prevent hemorrhage. C. To stimulate milk production. Or D. To prevent infection after delivery. What would be your answer? Alright, if your answer is B, you're correct. To help expel the placenta and prevent hemorrhage. A nurse is caring for a 37-year-old pregnant woman at 41 weeks of gestation. The healthcare provider has prescribed dinoprostone, dinoprostone or Cervidil to induce that labor. Which of the following is the most important nursing action before administering this medication? A. Assess fetal heart rate. B. Ensure that patient is well hydrated. C. Check the patient's temperature. Or D. Instruct the patient to avoid eating for 6 hours. The answer for that is The answer is assess for that fetal heart rate. A nurse is caring for a patient who is receiving oxytocin for labor induction. The patient reports increased pain and the nurse observes non-reassuring fetal heart patterns. What is the first action of the nurse should take? Stop the oxytocin infusion. B. Administer the bolus of IV fluids. C. Reposition the patient. Or D. Apply oxygen via face mask. The answer for this is A. Stop the oxytocin infusion. That will be your best answer. Let's move into the next question. A nurse is administering oxytocin to a patient to augment labor. The nurse observes that the fetal heart rate has dropped to 90 beats per minute for several minutes. What is the appropriate initial nursing intervention? A. Decrease the oxytocin infusion rate. B. Increase the rate of the oxytocin infusion. C. Stop the oxytocin infusion and notify the provider. Or D. Administer the oxygen via nasal cannula. Okay, what would be your answer? The answer would be C. Okay, stop the oxytocin infusion and notify the provider. A pregnant patient at 30 weeks of gestation is about to receive a misoprostol. Again, misoprostol to induce labor. Prostol, tol. Well, that is gonna be tocolytic. So, the patient asks the nurse how the medication works. What is the best response by the nurse? A. It causes your water to break, which starts labor. B. It helps soften and dilate your cervix to prepare for labor. C. It will make your contractions stronger, helping labor progress. Or D. It prevents premature labor by relaxing the uterus. What will be your answer? It helps soften and dilate your cervix to prepare for labor. That would be your best answer. And by the way, I would like to thank Keflin Dima Vivas, and of course, I would like to thank Chelsea Sausal also for their contribution and giving the ideas about this video review. Well, anyway, this is me, Nurse Rad, and thank you for watching. And don't be absent in school. Have a beautiful day.